Hello, my name is Georgia Reyes, and for my transmittable disease project, I will be talking about a fungus called Aspergillus. And Aspergillus is in a phylum called Ascomycota, genus green mold. This common mold is common in which it lives indoors as well as outdoors. It is used to produce soy sauce, toothpaste, chewing gums, as well as ink, things that we use every day. Aspergillus can also affect humans who are immunocompromised, basically saying that their immune system is really low and has trouble fighting off different pathogens. For Aspergillus, it can produce Aspergillosis in humans, which is people with weakened immune systems as well as lung disease are at a higher risk of developing. And there are 4 different types depending on the type of disease the patient already has, can affect their risk and health issues with Aspergillosis. Some of these risk factors that if a patient has can cause them to have Aspergillosis are weakened immune system, low white blood cell level, lung cavity, that's basically talking about patients who have had organs transplants, asthma or cystic fibrosis, as well as long-term corticosteroid therapy. For Aspergillosis, there are 4 different types, which are allergic bronchopulmonary aspergillosis, aspergillomas, chronic pulmonary aspergillosis, and invasive aspergillosis. For the allergic bronchopulmonary aspergillosis is usually most common for people who have asthma or cystic fibrosis. And in aspergillomas is usually for people who've had tuberculosis or lung diseases, and it's also common in chronic pulmonary aspergillosis. As for invasive aspergillosis, it can affect people who have weakened immune systems, such as people who've had stem cell therapy, organ transplants, and also getting chemotherapy for cancer. For Aspergillosis has a primary route of infection, which is inhalation of airborne Conidia. Conidia is the Aspergillus spore that is used to help reproduce. Here's picture that we have here showing the stages of Aspergillosis and how Aspergillus can cause Aspergillosis in humans. As I said before, the primary route of human infection is inhalation of the airborne Conidia. It is followed by the conidial deposition in the bronchioles or the alveolar spaces. Here. In healthy individuals, usually Conidia that is removed by pathogens or the mucociliary clearance in the lungs. But as for patients who has a weakened immune system, the phagocytes and the alveolar macrophages are having trouble trying to kill the Aspergillus Conidia that's already in the lungs. So this results in the Conidium establishment in the lungs, and that's when it starts reproducing during germination. And either the fungal is controlled by if the patient goes to the doctor and gets treatment. If not, in severe cases can cause neutropenia in the patient, which can have long-term effects for the patient. Aspergillus has different types of treatments and cures. Basically, they usually get monitored, like observations, to make sure that the medication, which is the antifungal medication, as well as oral corticosteroids, are helping get rid of all the fungus in the lungs. But if that is not occurring and is still germinating inside the patient's lung, surgery would be the best help for the patient. Trying to prevent this disease is quite hard, just in the fact that it is airborne. It is common in both indoors as well as outdoors. So having to stay away from the Conidia spores is hard. One way is that some people I do is by staying away from any mold they see that's around. If there's some in your house, best bet is to try to get rid of it, and just get regular checkups to make sure that there isn't a severe case during especially pollen days. Like in the spring, usually occurs the worst for patients with low immune systems.